a show by Puberty to Menopause, a public health awareness initiative by Human Biological Institute. Human Biologicals Limited is an initiative of Indian Immunologicals Limited. IL was established by the National Dairy Development Board in 1982, and its unit and later registered as company in 1999 with the name Indian Immunologicals Limited. HBI was established in the year HBI was established in the year 1998 with the Government of India requested IL to produce a modern tissue culture anti-rabies vaccine to phase out the unsafe nerve tissue vaccine. The first manufacturing facility of HBI was established at Ooty. The facility is one of its kind in India to have rolled out first Vero cell culture with rabies vaccine in 2000. Subsequently, HBI launched other vaccines and currently we are a major player in human vaccines. Leader in ARV segment and present in around 60 countries. We have three state-of-art manufacturing facilities at Ooty, Gachibowli, and Karkapatla, that is Genome Valley. HBI has forayed into a market of clinically proven wellness products and for infertility range of hormones. Our vision is shaping global healthcare and spearheading the One Health initiative. Mission is to innovate, produce, and market quality healthcare products and to service to improve and extend lives. Our values, and we believe in providing affordable products with high quality through continuous technical innovations and improvements to meet our customer need. As a corporate social responsibility, we have adopted schools where IL is providing infrastructure and basic facilities, including in helping midday meal program. In association with NDDB, we have through NDDB our gift milk program. Hundreds of school-going children are benefited daily. We have also donated oxygen generation plant to Telangana Institute of Medical Science, Gachibowli, Hyderabad. These are information about Indian Immunological Limited. These are few information about Indian Immunological Limited. For more information, you can also log on to www.indimmune.com. Puberty to Menopause is yet another initiative of Human Biological Institute, where we talk about everything and anything on women's health. Today, We Talk Do You show is dedicated to yet another very important topic, that is understanding recurrent miscarriages. Today, we have Dr. Swati Gupta with us. Dr. Swati Gupta holds a degree of MBBS MD in obstetrics and gynecology and also completed specialized training in gynec laparoscopic surgery and hysteroscopy. In addition, she holds a fellowship in assisted reproduction. Ma'am has more than 20 years of experience and highly skilled in several specialties like in vitro fertilization, laparoscopic surgery, cesarean sections, and hysteroscopic treatments. She is also the founder of Ashirwad Hospital and currently practicing in Ashirwad Hospital, Indira Nagar, Lucknow. Most welcome, Dr. Swati Gupta. Thank you so much for being with us today on We Talk Do You show.
Good afternoon, everyone. I'm glad I'm here today to talk on this very important topic, the recurrent pregnancy loss. Thank you so much.
Thank you, ma'am. Thank you. Let's start our show with common questions, ma'am. What the audience wants to know and the woman of India wants to know about the topic understanding recurrent miscarriages. Ma'am, today's our first question is what is recurrent pregnancy loss? Now, how will you define it?
Actually, miscarriage abortion is such a thing which normally affect not only the physical, also the mental health of the woman. And if it happens twice or thrice consecutively with the couple, so it is called recurrent miscarriages. It can be primary or secondary. Primary, if the couple is having previously no live issue, then it is called primary recurrent miscarriage. And secondary, when they are having one live issue and after that they are facing this problem.
So, like, ma'am, how common is our miscarriages? Like, every woman does it. Like, how will you say how common it is?
Actually, 50% of the pregnancies normally get failed, and most of the couples are not aware of it. And 10 to 20% of the patients suffers one spontaneous miscarriage in their lifetime. But recurrent miscarriages rate is around 2 to 5% of the couple faces this problem in their lifetime. But if they take proper treatment, 80% of the couple get healthy baby after this proper treatment and investigations.
Ma'am, like this is the world of busy life, so everyone is busy and they're very prone to different kinds of risk factors. Like, what are the risk factors you mentioned for the miscarriages? Like, what most common risk factors like the woman faces for the miscarriages?
Actually, in today's scenario, the most important risk factor is age because now marriages are occurring at later age. So women are also getting pregnant at higher age, more than 35-year old. They are getting pregnant if they are elderly gravidas. Mostly they are elderly gravidas, and they are mostly now it's a Western world culture. We have adapted the Western culture, so excessive exposure to smoking, alcohol, caffeine, so this also leads to increased chances of recurrent miscarriages. And also the obesity is one of the more important factors.
So thank you for saying this risk factors, ma'am. I guess our viewers get a clear point, like what are the risk factors for the miscarriages. Ma'am, how will you, like a woman comes to you, like with a history of prior miscarriages and all. So what she has to do and what are the investigations she has to undergo if she has a miscarriage in before or she has a history of any miscarriages?
Very important question. But before that, I would like to tell you about the etiology of this recurrent
Yes.
50% of the couples we don't find any cause. So 50% of recurrent miscarriages unexplained. But in 50% of the patient we can get a cause. It may be genetic. Most of the first trimester abortions are because of some genetic issue that may be related to embryo or couples. There may be some chromosomal abnormality in the couple or some endocrine factors like thyroid or diabetes. And we have the woman is having some anatomical factors also. Her uterus is not anatomically normal. Maybe it's bicornuate uterus, unicornuate uterus, or diadelphus. Or she's having fibroids or polyp inside the uterus, or septum inside the uterus. Or there are other causes also like thrombophilias, autoimmune disorder, immunological causes. So these all can lead to recurrent miscarriages. And now we will investigate these causes according to the patient previous history, according to her medical history, her surgical history, her family history. According to these, we will then investigate. We cannot give the whole battery of tests to every patient.
Yes.
According to her profile, we can offer the test. If she is obese or of elderly age, then we will definitely do her blood sugar, her thyroid, her serum progesterone level. We can also do during his ovulation phase or in the 21st day of this cycle. Is it in the normal range or not? We can do the 3D ultrasound to identify any anatomical factors involved or not. And if the couples are facing every time first trimester abortion, then we can offer the genetic test like microarray test of product of conception, or we can offer
Okay.
typing to the patient. And there are also blood tests by which we can identify the infections. If the woman is suffering from some vaginal infection like bacterial vaginosis or some viral infection, torch profile we can do. And there is thrombophilia profile. So these are the tests which we can offer to the patient, and according to that, we can investigate and we can identify the cause. What is the cause of this recurrent miscarriages?
Thank you, ma'am. Thank you for explaining etiologies behind the miscarriages so well. And ma'am, like we have a question like the woman undergoes recurrent means like how recurrent, ma'am? Is it the first time is termed as recurrent or like the second time? Like how many times the woman has to
Actually, previously it was defined three or more miscarriages consecutively. But now the various guidelines suggest that if the abortions are occurring consecutively twice, so then we have to investigate the patient. Why is it occurring? Then after two losses, we also labeled it as recurrent miscarriage.
Okay, ma'am. Thank you for saying this, ma'am. What are the management, what is the management for the recurrent miscarriages, ma'am?
First off, and most important thing, as I already previously said, that this abortion is very devastating experience for the couple. It all affects mental health, it affects family health, and even the women go under anxiety, depression, all of this mental issues she is facing. So first and most important thing is proper counseling of the couple. And proper, even they can need a genetic counseling also if the genetic cause is involved. And then the tender loving care is the one of the most important thing, and which is also written in our books that this is the most important treatment. And if we give the positive attitude to the woman and the couple, then definitely sometimes it helps a lot to carry a successful pregnancy. And along with that, the lifestyle modification, taking healthy lifestyle, taking healthy diet, physical exercise, stopping the sedentary lifestyle habits. So, and avoiding these exposures to smoking, alcohol, even not only the woman, also the man has to avoid these things. So then only the quality of the egg and the sperm will be normal. So in that case, the embryo which will be formed, it will be definitely normal, even in the natural pregnancies also. So this is the first most important thing. And then according to the cause, we can offer the treatment. If there is some genetic issue, then we can give them reproductive options like gamete donation. And if they are undergoing IVF, then we can do the PGTA test to identify the euploid embryos. And there are certain drugs also which are help if there is immunological. Sometimes there is abnormal response of the woman to placental and fetal antigen, so we have to reduce this abnormal response. So we can give some this ecosprin and low molecular weight heparin injections to increase the blood supply. And also we can treat this all the infections if she is suffering from any infection. We have to control her diabetes, her sugar. We can surgically correct any anatomical cause if there is involved. Like we can correct some causes, and some if there is some genetical issue in the uterus, say that we cannot correct. But if there is a polyp or if there is a fibroid, if there is a septum, so we can do the correction. Sometimes women faces this type of abortion in second trimester. So most of the time it is because of cervical incompetence. The cervix is not that tight enough or is not that much length which is required to carry a good pregnancy. So in that case, we can offer the cervical cerclage also. So these are the things which we can do for treating these kinds of patients.
Thank you, ma'am. Thank you for mentioning that miscarriages do happen because of the genetics of men also, like the father who is of the child, or the smoking and extra things. Thank you for mentioning this, ma'am. Ma'am, as you mentioned about the circlage, like many women in the pregnancy get scared to get a circlage done because it's a small kind of operation. They feel it. Like, how do you emphasize and enlighten on the circlage, ma'am?
So normally we do cerclage, we do normally transvaginal ultrasound to identify the cervical length of the patient and the previous history of the patient. If the patient is having always the second trimester losses, so it's mostly, and the cervical length is also less than 3.5 on every scan. So in that case, we will definitely counsel the patient to do undergo this cervical cerclage, and it's a very small and minor procedure which we normally I prefer to do in early morning so that women do not have to take do fasting for a longer time. In the morning, they come in my hospital and it's just done under the short GA. Do not require a full general anesthesia or a spinal anesthesia, no such kind of things. It's a small short GA procedure. And then after that, it's just hardly take half an hour. And after that, we keep patient 3 to 4 hours in our hospital to for the rest, and then after they can go to the home. And just but after this cervical circulage, they have to take care of their self for at least 10 to 15 days, and after that they can do. But for these patients, because the cause was shortening of the cervix, so the lifestyle is little bit restricted for 9 months. Okay, because they have to carry the pregnancy at least till to 37 weeks, so they will get the healthy.
Like, ma'am, how common is preterm births in recurrent history of recurrent miscarriages, women, ma'am? Like, is it
No, it's not related. Both are the different things. Not preterm is normally happens in the patients who are facing with recurrent miscarriages, because first trimester the cause is totally different. Only in the second trimester if it is happening, and if she's not under the good supervision. So in that case, we faces this preterm births, because now we can give the vaginal progesterone. Also, there are quite often we can give this injections, bed rest, and this os tightening procedure quite helps patient. And they normally continues the pregnancy till 34 to 35 weeks, and sometimes at 37 weeks also.
Thank you, ma'am. Thank you for saying, ma'am. Ma'am, like as you mentioned, lifestyle really matters for the woman to conceive and this prolong the pregnancy. So, ma'am, can you please give some lifestyle tips to today's generation girls and women who are watching us today?
Actually, lifestyle is one of the most important thing at every stage of life. Not only for the girls who are going to the school, also in the or adolescent girls in the reproductive age, and even after in the menopause also. Because women's health, there are a lot of changes because of hormones, because of atmosphere, because of, I think, the responsibilities we do in the society. All things have some impact on us. So the school going children's also, not, I'm just talking about the health. School going girls also should do at least some physical activity daily to keep
True.
their self healthy. And because I normally faces the problem in my OPD, most of the adolescent girls are coming with the irregular periods, because they are adapting now the this sedentary lifestyle, the mobile, iPad, indoor games only, and not going outdoor for any activity.
Yes.
And they are taking this high fiber. They are not taking high fiber diet. They are taking this bread, biscuit, and munching always. So this is all not good for the woman's health. In the adolescent also, in the reproductive age also, they just, in the simple language, the सात्विक भोजन जो हमें पहले सिखाया जाता था, it's the most important thing for the reproductive age group also. They have to take the whole meal, the protein. They should take proper protein. They should take proper vitamins, so green vegetables, fruits, dry fruits, and simple diet. They don't do. They should avoid the fried food, sweet things, and outdoor eating. It's totally they should avoid. Just delete these apps, Swiggy and Zomato from the mobile, so that this extra eating can be avoided. And definitely do some exercise, whatever you want. You can do, either you can, if you cannot go outside, so you can do yoga at your home, you can do Zumba at your home, and you can do outside. And no, you don't know how to do gym, so then in that case you can do walking only. So 40 to 45 minutes per day walk is very important. And avoid these things, smoking, alcohol, excessive caffeine, when you're planning pregnancy. At least at that time you should avoid, not at just with at that time, before 3 months you have to avoid these things.
Thank you, ma'am. Thank you for saying such good lifestyle tips. Like, oh, I guess all the women who are watching over India, like all over the India, will follow. Will definitely, ma'am. What is your take-home message for our audience for today's interview, ma'am?
As I already told you, this recurrent miscarriages only affects 2 to 5% of the couples, not all the couples. And in 50% of the patient, we don't know any cause. So it requires a multidisciplinary approach. It requires a proper counseling of the patient, psychological counseling, and again, the tender loving care is the one of the most important things. Supportive atmosphere in home is also very important. Okay, everybody, if the woman is not giving birth to a live baby, everybody is against her. Everybody is giving suggestion. You do this, you do that. Just let them do by their self whatever they want to do, and a good investigations according to their history. We can offer some investigation, either it is anatomical or endocrine or immunological or thrombophilia, whatever it is. We can offer these tests, and according to that we can offer the empirical treatment also, which involves giving this multivitamin tablets with high progesterone therapy, this immunomodulators we can give, this anticoagulant we can give, antibiotics we can give. So there are treatment which can help these patients to carry a successful pregnancy.
Thank you, ma'am. Thank you. I really enjoyed taking interview from you. Your insights are most valuable for us. Thank you so much, Dr. Swati Gupta. Thank you so much. I'm sure whoever is watching this video now and would be watching this in future will be benefited with all the suggestions and insights given us today. Thank you so much for
Thank
joining us to We Talk Do
thank
You
you
Show,
very much.
ma'am, today. Thank you.
Thank you. uh,
It was my pleasure hosting Dr. Swati Gupta ma'am today in We Talk Do You. With this, I would request all the viewers to follow us on puberty2menopause.com in all and puberty to menopause in all the social media platforms. And if you feel us and want us to bring out such kind of topics, please do write us on puberty2menopause.com. We will come to you with more interesting topics and series from the leading healthcare experts of our country. Thank you so much for joining us today. Thank you so much, Swati Gupta.